Good afternoon, everybody. I'm Sayukta from Vistas Media, your host for today on Here All Issues Are Resolved YouTube channel. We go through a lot of looks, beautiful, related issues as we grow up, but little do we realize that it's our hair that's our crowning glory. Our hair symbolizes health and personality. Gorgeous and healthy hair is an instant confidence booster. To guide us on how to take care of our crowning glory, that's our hairs, we have with us an expert dermatologist, Dr. Rachita Dhurat, live from RD Clinic Mumbai. Dr. Rachita Dhurat is a board certified dermatologist and a global trichiatrist with 35 years of experience. She is currently a professor and head of the Department of Dermatology at LTM Medical College and Hospital. Post her duty hours, she also helps patients with their problems from her private clinic. Her experience has been unparalleled with a plethora of research work and publications under her name. She is renowned not only domestically but also globally, especially for her groundbreaking work in the field of trichology. She founded a premium conference named Trichology Update in 2014. The conference attracts some of the well-known professionals across the globe with the aim to educate young doctors and put these learnings into their regular practice. Today, through our live talk show, Dr. Rachita Dhurat will guide us about hair care in the current scenario. A very warm welcome to you, Dr. Dhurat. It's a pleasure to have you, to have a luminary like you with us for this session, ma'am.
My pleasure.
As today we are going to talk about hair care, doctor, first of all, because every day we see some of the our hairs shedding from our scalps. We know it's hair fall, but we don't know what's normal and when to be concerned. Please guide us on that.
A very good question, Sayukta. It is always a custom belief that losing 100 hair is normal. However, I don't believe in that 100 figure. Now, imagine if you are losing 100 hair per day over 30 days, you will be losing how many hair? You will lose 30,000 hair.
Yes.
And hair growth is not equal to your hair loss. And then how many years you have to take to regrow those hair. So don't consider that losing 100 hair every day is not normal. So occasionally it is okay. But so for in my opinion, if you're losing more than 50 to 70 hair every day continuously, you should take it as it is not a normal thing. And then you need to consult a good trichiatrist for that. There could be many reasons for that. So we need to find out the reason. So my message is that don't consider it 100 hair. I have seen, especially in women, they feel that I'm losing hair. It is a normal phenomena. It is 100 hair. So I don't have to consult. And by the time they come to us, they are already bald. Already their scalp is being seen.
Right. And, I always wonder whenever I see these stats that, 100 is normal and anything beyond 100 is when you should be concerned. I always wonder how to keep a track that I have lost 100 and now I'm losing more than 100. So I think by what you're saying, if we see that, hairs are falling, then we should be concerned and we should go and consult a trichologist or dermatologist, right?
Simple. I can put it like that. If you're getting a chunk like this every day, if you don't have time to calculate, because when I assess my patients, I ask them for a hair count. Hair count is at least they can do the hair count of 1 day, 2nd day, 3rd day.
Right.
Yes.
Right.
And it crosses is of now particularly every day. If it is crossing 70, 80 or 100, then that is alarming. So if you don't have the time to count, you just think of this much chunk of every day. If you're getting it, then it is alarming situation.
Okay, right. And what are the general causes of hair loss, doctor?
There are many causes. The commonest I like to tell that is androgenetic alopecia. You must have heard of the common baldness. Most of the men do get a common baldness. balding in the frontal or balding on the vertex. Correct. So it's very easy for any male individual to identify that he is suffering from this disorder. However, it is difficult to understand for a woman whether she's having a baldness or not, because in women the pattern is totally different. In initial stage, you can lose plenty of hair every day. They try to take some home remedies. They try to take any supplements which is which has been advertised,
Right.
and without noticing that they are getting results or their hair fall is arrested, they do not seek consultation. And remember, if you lose your 1,000 hair today, you are not going to get all hair 1,000 hair completely. Even if you get 1,000 hair completely, it may take to regrow your hair. It takes years.
Exactly.
Yeah. So it must be knowing when you trim your hair, there are many people, women say that my hair length was very long at, now it is not growing beyond this.
द थिंग इज डॉक्टर, कई बार हम देखते हैं कि अगर किसी भी ऑर्गन के साथ कोई दिक्कत है, हमारी किडनी में कोई दिक्कत है, हाथ में कोई दिक्कत है, तो हम बिना टाइम वेस्ट किए तुरंत उसके एक्सपर्ट के पास जाते हैं. We'll go and consult a nephrologist in case we have some renal issue. We'll go to a cardiologist in case we have some heart issue. लेकिन बाल और स्किन एक ऐसी चीज है, उसमें जब दिक्कत होती है तो हम सबसे आखिरी में किसी एक्सपर्ट के पास जाते हैं, डॉक्टर के पास जाते हैं. बाकी टाइम जैसा कि आपने कहा ओवर द काउंटर जो सप्लीमेंट्स मिल रहे हैं वो हम यूज करने लगते हैं. ओवर द काउंटर मेडिसिन, सेल्फ मेडिकेशन, होम रेमेडीज, सब पे हम टाइम लगाते हैं लेकिन डॉक्टर के पास नहीं जाते. हाउ डेंजरस दैट?
See, basically, there is no awareness amongst our patients that hair loss is the disease. It is being considered. उनको ऐसा लगता है बाल झड़ते ये तो कॉमन है, होता ही रहता है, बीमारी आ गई इसलिए बाल झड़ रहे हैं, या हम लोग डाइटिंग कर रहे हैं, तो ये कॉमन चीज उनको लगती है. उनको लगता नहीं है ये बीमारी है करके. और अगर बीमारी जब लगती है तो उनको समझ में नहीं आता किसके पास जाना है. उनको ये समझ में नहीं आता है कि डर्माटोलॉजिस्ट इज द बेस्ट वन हु कैन ट्रीट. अगर जिनको समझ में नहीं आता तो वो जो मीडिया दिखाएगी या जो ऑनलाइन जो चालू है प्लेटफॉर्म, वो देख के लूर होके वो लोग ट्रीटमेंट लेते हैं.
राइट. आई कंप्लीटली गेट
करना बहुत जरूरी है इसमें.
Exactly, you're absolutely right. And one more thing, from a very layman's perspective, I'm asking this question. We always get confused when it comes to hair loss and hair fall. Is there a difference between these two terms, hair fall, hair loss?
Or alopecia rather.
Okay. Please shed some light over that.
Basically, hair loss, hair fall is both are synonyms.
Okay.
Now, alopecia is normal hair loss is and hair fall is synonymous. Alopecia is, that means you are losing excessive of hair, like what I said, which is not normal. So any abnormal loss of hair, it is alopecia. In that you can have obvious baldness or you may not have obvious baldness. People think that alopecia means bald. I'm getting baldness, that means alopecia. So for them, I want to make them understand that without baldness, you can have alopecia. So that we treat with a trichoscope or dermatoscope. We find out the certain clues to diagnose.
Right. And can a person's lifestyle play a role in hair loss, doctor?
Of course, absolutely. For example, in earlier days, in my parents or your parents, they must not have noticed hair or androgenic alopecia, baldness before 40, 50 years of age, most of them. But nowadays, you see all 15 years, 16 years, 20 years of, girls and boys are suffering from this androgenetic alopecia, though we called as it is a genetic. Now, why these genes are highly expressed or overexpressed in early ages? The reason is because lifestyle, other environmental factors, and many other things. while their parents may not be having the disorder. So it is not necessary. They will be carrier of genes, but genes are not expressed well because they have very good, healthy lifestyle.
Exactly. So what we need to do, I mean, if we can start from very basic, how to rectify our, loopholes in the lifestyle patterns we lead to at least, take care of our hair and our health.
Absolutely.
Right. And doctor, when you said कि कई बार लोगों को लगता है कि बीमारी हुई है तो हेयर लॉस हो रहा है, कॉमन है, ये तो होता ही है, लोगों क्या एक जनरल नोशन है, लेकिन क्या हेयर लॉस हो रहा है इसका ये भी मतलब हो सकता है कि कोई अंडरलाइन मेडिकल कंडीशन है, कोई बीमारी है, इसलिए हेयर फॉल हो रहा है?
So abnormal hair loss, or rather I can say is, which is alopecia, bound to have underlying disease. It is a cause, it is a disease, it is a disorder.
Right.
So we need to find out what is the disease which is causing hair loss or alopecia. So there are a variety of the causes. Like the commonest, I said, androgenetic alopecia. Similarly, you can get it the same condition in females, where we called as female pattern hair loss. Or many times you can have post-infection or post-illness or post-COVID, or even rather I can say your medications you consume day-to-day practice. The commonest being your gastritis ke liye people keep on taking medicine, or some painkillers, or knee joint pain. You keep on taking medicines for that.
Right.
You take medicine for constipation. If you're taking over a period of many months, probably you may get drug-induced hair loss.
Oh.
And you're dieting, you're crash dieting, you're very much stressful, either physical or mental stress. Like if you have breakup or your job loss, there are many, there are so many stresses are there in our, but not a day-to-day stresses. And there's acute stress where you are being disturbed mentally. That also can cause hair loss. These are the common causes of hair loss.
Right. And what are the medical treatment options available for hair loss? Topical, oral, surgical, non-surgical? What all options are available?
First, we need to diagnose what is the disease. Like each disease has its dedicated treatment protocol.
Right.
For example, a person having patchy hair loss or complete baldness of hair over a short period of time, the disease is different than your androgenic process. The treatment is totally different for that. Right. In some diseases, you get the hair loss which is permanent. That is called cicatricial alopecia. The treatment for that is totally different. So I won't able to tell you that, oh yeah, this is the set of the treatment for all types of the hair loss.
As there are n number of causes for hair loss, then the treatment actually will depend what is the actual root cause of that particular individual. Now, we would also like to, as you mentioned, nowadays people go a lot for dieting, crash dieting, a lot of fasting, etc. is there. People do that. People eat for maybe 8 hours and fasting for another 14, 16 hours. Are these practices, because I have heard this many a times, that after following a certain crash diet or fasting schedule, people tend to lose a lot of hairs. So how these diets result or have impact on our heads?
Once your energy requirement goes down, it will affect badly on your hair. It's a simple reason. When you are doing something abnormal, your body will protect your vital organs, correct? Right. What are the vital organs? Your heart, your lungs, intestine. That means you don't get heart attack, you don't get diarrhea, you don't get any lungs problem. However, for body, hair is not a vital organ. So that's when you lose hair. So all stresses of body will come to hair because it is not important. And really it is not important.
Mhm.
It's a cosmetic importance.
It's a cosmetic thing, exactly. Or I think
It is body. It is not important. Body will think of cosmetic. Our mind will think for cosmetic.
राइट अच्छा डॉक्टर, मैं ये भी जानना चाहती हूँ, रिसेंट टाइम्स में हमने एक बहुत बड़ा मामला देखा जब एक बहुत बड़े ग्लोबल अवार्ड फंक्शन में मजाक उड़ाया गया था एलोपेशिया का, और maybe the person was not aware of the health condition, और उसको लेकर क्या कुछ हुआ ये भी हमने देखा। उसके बाद बहुत बड़ी एक बहस भी छिड़ी कि people are not aware of इस तरह की चीजें, उनको लगता है कि अच्छा बाल झड़ रहे हैं, और वाकई में बॉडी शेमिंग का एक बहुत बड़ा पार्ट हेयर से रिलेटेड होता है, और डे टू डे लाइफ में हम सब ने कभी ना कभी वो झेला है। हाउ इम्पोर्टेंट इट इज टू ऑल्सो अवेयर पीपल कि सी ये एक हेल्थ कंडीशन है, ठीक है बाल है, अच्छे हैं, हेल्दी है, बहुत अच्छी बात है, लेकिन नहीं है तो उसे भी हमें एक्सेप्ट करना चाहिए।
No, suppose if I don't have hair, what will happen to my health? Nothing. Yeah, if I lose one side, it will have hampering in my day-to-day activity. But losing hair, if I am totally bald, it's not going to hamper my day-to-day activity. I'm healthy, talented. I have 2 hands, 2 legs.
Right.
Okay. So you need to think positively, because there are certain conditions where you can lose complete of your scalp hair, and many times may not be reversible. It can happen. But that does not mean you should get depressed with that condition. When you have talent, you utilize your talent. You have 2 hands.
Exactly. So be happy in whatever way we are. Just take care of the things we have in our hand right now. If you have good hairs, take good care of it. If you have any health hair related issue, go and consult a dermatologist, a trichologist. That's really important. Don't waste your time and home remedies or self medication or over the counter medication, etc. Doctor, we would also like to talk about the role of nutraceutical in hair health.
I would say that nutraceutical is helpful, provided we couple with the treatment part for that particular disease. Now, if you ask me, only nutraceutical may not work.
Okay.
May not work.
Unless it's with the whole line of treatment.
Like in when you eat, do you eat only your chapati or roti or sabji? You eat everything.
Right.
Then only you can build your body properly.
Exactly. As we were talking that a lot of people just go and buy supplements because they know, okay, बाल झड़ रहा है तो जरूर जिंक सप्लीमेंट की जरूरत है, आयरन सप्लीमेंट की जरूरत है, बायोटिन की जरूरत है. They'll never go and consult a doctor before taking them. And now एक पूरा line of products है where they have green tea extract या omega-3 fatty acids etc. सब लिखा होता है, और हमको लगता है बस ये खा लेंगे, ले लेंगे, यूज कर लेंगे तो हमारी सारी प्रॉब्लम सॉल्व हो जाएगी. प्लीज एनलाइटन अस ऑन दैट, क्योंकि ये अभी बहुत कॉमन हो गया, स्पेशली आफ्टर सो मेनी इन्फ्लुएंसर्स, so many videos etc. which is everywhere available very easily. People are so convinced कि इनमें से कुछ भी प्रोडक्ट आप यूज कर लो, आपके हेयर में कोई प्रॉब्लम नहीं होने वाली है, जो प्रॉब्लम है वो सॉल्व हो जाएगी.
Okay, this question reminds me of a case of my patient who was having hair loss, and his gym instructor told him to take this supplement, this supplement, this supplement, and then he was taking at least 12 bottles of supplements. I have photographed those 12 bottles. I said the hair loss problem is more of hypervitaminosis, overdose of vitamin supplements,
right,
rather than any disease. So this could possible that we keep on taking. Now, what I'll tell you, what happens in hair loss, a patient with hair loss, some friend will tell you take this medication. He will Google out, there will be some another medication. Third person will advise you take that medication. That pile up to take multiple multivitamins, and that should be avoided.
right.
Suppose if you are taking 1 or 2 multivitamins, in case your hair fall is not stopping over few weeks or few months, you must consult a trichiatrist. Now, here I would like to enumerate the difference between trichiatrist and trichologist. Like if you have ophthalmologist and opticians, where you go to for the your eye problem, you go to ophthalmologist, not the opticians. If you have psychiatric problem, you go to a psychiatrist rather than psychology. Psychologist is not a doctor. Similarly, psychologists may not be doctor. They are basically people who care for hair beautifications. So proper terminology is a trichiatrist, who is a board certified dermatologist with in-depth knowledge in hair disorders.
Okay. So now at least we know whom to go in case we have, hair-related issues. And we would also like to understand the role of micronutrients. I mean, not those vitamin supplements, but what we can have in our, day-to-day thali, day-to-day plate, micronutrients.
It's a simple word. What your parents are eating, full balanced diet. You have to eat that. People are eating all junk food. No, maida, pasta, noodles, you name it. This should be avoided. So you should have balanced diet. In addition to that, you have to increase your amino acid component in your diet, such as you take soaked almonds, chana, these will, and soya. This will contain more of amino acids.
Right. So now we know, what's the best thali. The Indian thali is the best thali. So that's really balanced.
Yeah.
Okay. And doctor, one more thing, because in India, again, we have the tradition, which is not very much seen outside India, oiling our hairs. And we actually like, keeping that oil on our scalp for as long as possible. We like to sleep with that oil on our scalp. We like to go out with that oil on our scalp. And we feel in a way that the oil is going to, give nutrition to our hair. Is it true?
See, if you look at this, all oils are not bad. Or all oils are not good also. Some of the oils which have been tested, which do have some ingredients in that to arrest hair fall. However, using castor oil, I'm against using castor oil, because castor oil is very heavy oil, which can damage your cuticles, which can cause your damage to your hair follicle roots also. So I would not say that oiling does not help at all, but then provided these oils should have some active ingredients to arrest the hair.
Okay.
So if you take only simple coconut oil without any ingredients, it will work like you're conditioning your hair, like frizzy hair conditioning, which will not have any active ingredients to arrest hair fall or give hair growth.
Right. So what active ingredients are you talking about?
Yeah, are plant-based active ingredients, Mahabhrut Raj or Amla or hibiscus ingredients. There are some active ingredients. Or sometimes you can have olive oil type, not olive oil, garlic type of ingredients are present in coconut-based oil.
Yes. These days, black seeds, kalonji.
Your onion oil.
Yeah, yes.
I would not say that they will make a wow difference to your hair fall, but you may try out. If you have the time to visit a doctor, you may try out. But don't heavy oils. Heavy oils, how to identify the heavy oils, which is very, sarso ka oil type.
Right.
Oil, very
thick. Very thick and chip, which, gets sticks to our fingers.
And don't overuse your oil. People have seen overusing oil in a hope to get more hair faster.
Yes. I know. And doctor, we would also like to discuss about dandruff, because again, dandruff is a very common problem that almost everybody faces, and how to tackle dandruff issue.
Well, Dandruff could be mild or it could be severe. Now, if you have mild dandruff, like occasionally it is coming, and you're shampooing on every other day and it is under control with any anti-dandruff shampoo which is there in the market, well, you should be happy. However, if you are not able to control your dandruff with anti-dandruff shampoo, the pharmaceutical companies have different kinds of shampoos which can help to tackle this issue. However, one point I would like to mention here strongly that nowadays I do see scalp psoriasis, which is a skin as a disorder which mimic like dandruff.
Okay.
And then you need to diagnose with a dermatoscope. It's similar to dandruff, but it is not dandruff. It is a scalp psoriasis. And treatment for scalp psoriasis is totally different.
Now, how as a layman am I going to,
No,
find out?
that's
Because
correct.
I don't know, I have dandruff issues, so
Yeah.
I'll just go
Yes,
and
I
yes,
know.
yes.
Message is that if your dandruff is not controlled by multiple anti-dandruff shampoos, then you must go and consult for scalp psoriasis.
Fair enough. Right. Doctor will also pick some of our viewers' questions.
Sure.
Tanmay Yadav is here asking, who do I see for hair loss? Is hair loss hereditary?
What is the next question? Second question?
Is hair loss hereditary?
Not hair loss. All hair loss is not hereditary. Only one disease, which is the androgenetic alopecia, is hereditary. However, I am telling you, not necessarily that your parents had been suffering from this disease. You must be carrying a genes, and the genes are overexpressed in you. That's why you are getting hair loss in earlier age.
Right.
So not all hair loss is hereditary. There are many other hair loss which is temporary, which is like post-COVID, post-illness, post-surgery, crash diet, drug-induced can cause hair loss. They are short-term.
Right. And okay, Ishita Jha is asking, do hair with split ends never grow?
Split ends mean I'll tell you. What is the question? Repeat again, then I'll be able to explain you properly.
Do hair with split ends ever grow?
So, issues mean to that hair grow from the here?
From here. Yeah, that's what the question is suggesting.
This is the plant. I'm cutting this plant and it grows from here, correct?
Right.
You cut your hair from here, it is not going to grow. Why? Because this is a dead tissue,
Right.
while this is a live, and that's why it grows from here. So if you have the split ends, if you cut it here, you will get rid of the split end, but it is not going to grow from there. The growth is from the root. Remember that.
So it's again a myth, because many a times it's said that, okay, if you have split ends, especially saloons, parlors, they'll, set this sales point. If you have split ends, it's not going to grow. So I think that myth is busted now.
Yeah, but it will help to, improve your split ends, because you're cutting that portion. So you're making your hair not thinner.
Right.
So when you have a split ends, it goes and it splits on a higher level.
Right. So that way, I mean, trimming is good, but then this myth should be busted. That's with split ends, your hair won't grow. Okay, Adi Jan is here asking, am I at risk of over styling? Using a lot of straighteners or blow dryers or gels, etc., are going to make our hairs,
Yeah, it makes your hair frizzy, dry, lusterless if you are doing over every repeatedly, because there is some amount of damage. And in the damage to hair cuticle is permanent unless you get a new hair growth again.
Okay.
Yeah. So you need to judiciously choose how much, hair cosmetic you want to go for it.
You should be able to decide how much risk you want to take
Yes,
in terms of
yes.
hair. Okay, doctor, we have Sonia Sahu asking, my hair is frequently falling and dandruff and itching are also existing. Doctor, can I get a biotin tablet for all these issues? Please help.
Yes, it's so good you asked me this question. I'm thankful to her. Biotin doesn't play any role in hair loss. It is again myth amongst in people that biotin plays a very good role in hair loss. No, not at all.
Oh, because many a times, I have personally seen people going and buying Baton and, stocks and restocking it and popping it again and again every day, just in hope that they'll have good hair.
In
So,
fact, sometimes you can high biotin levels can hamper your thyroid levels.
hmm. Yeah, that's why we are continuously saying this, that, don't just go blindly and, keep shopping for multivitamins or, vitamin supplements or biotins, etc., unless you have that deficiency and doctor has advised you to go for it. तो कई बार होता है कि हमें लगता है अच्छा बाल गिर रहे हैं तो बायोटिन खा लेते हैं. बायोटिन तो सबसे आसान है. आई थिंक सबने कभी ना कभी लिया होगा. तो ऐसा नहीं करना चाहिए, and excess of everything and anything is bad. So yeah, I think one more myth busted. We have Dave Saxena asking, how do I know if my hair loss is due to male pattern baldness? लड़कों को ये बड़ी समस्या होती है, डर भी रहता है कि मेल baldness है क्या, pattern baldness है क्या?
Oh, basically, if you're losing from this portion, frontoparietal portion, or if you're losing from here, if you're seeing any thinning here on the vertex here, then you think of it as a male pattern type of baldness.
Right. Okay, Parul Shinde, again, a very common question that people, are confused about. Are shampoo brand really makes a difference, or are they just, overhyped?
It's not overhyped. I can say some of the shampoos do have some ingredients in that, like caffeine and other ingredients, which help to arrest your hair fall. I'm not saying that it will grow your hair.
Mm-hmm.
It will help to reduce your hair fall.
Okay. And then again, we have, cosmetological hair products and medicated hair products. Which one do you recommend?
Answer to this question is not very straightforward. Unless I see my patients, I take history. It's a holistic approach. I mean, it is an individualized approach. It cannot be a set menu. अच्छा आपको ये है ये है. I need to check everything. I need to see a trichoscopic finding. I need to see her history. I need to see the clinical examination, some certain blood test, and then I come to the proper. Yeah, now you require this kind of the treatment.
Right. So it depends. And for that, we should definitely go and seek the help of an expert. Akash Singh is asking, can accessories like helmets worsen hair loss?
That is also myth. That is also myth.
And many a times, especially I've seen boys, they'll avoid wearing helmet just by saying that, yeah, baal chharte hain, baal gilte hain. So that's again a myth.
That is a risk.
Please, if you can, just address our viewers on that.
That is not wearing a helmet. It is a risk to their life rather than improving in hair loss condition.
I think ये भी prioritize करना जरूरी है कि बाल ज्यादा आपको प्यारे हैं या जान ज्यादा प्यारी है. तो बाल गिरते हैं या नहीं, वो मैडम ने भी कहा कि इट्स अ मिथ, नहीं गिरते हैं, लेकिन जान जाने के चांसेस बहुत ज्यादा बढ़ जाते हैं. तो प्लीज वेयर अ हेलमेट. शिल्पी मेहरा पूछ रही है, मैम एक आइडियल हेयर वॉश कितना करना चाहिए या एक को कितनी बार हेयर वॉश करना चाहिए, उसके बारे में जानना चाहिए.
अच्छा, वो that depends upon your hair condition, your physical activity. Like suppose if you are your physical activities of every day and you are sweating. So you need to wash your hair every day. However, washing your hair every day make your hair frizzy. So for that you require very mild, gentle shampoo. Now, if you're oily, your scalp is oily, you have to wash every day. Correct? So there also you require some kind of the shampoo which will not cause the post-wash dryness, frizziness. Otherwise, normal hair, you can shampoo 2 or 3 times a week.
Right.
But then there are some people who do not shampoo at all. That should
Okay.
not be done. It's a hairy area. It's a hairy area. And so much dirt, sebum accumulates in your scalp, skin. That can cause also your hair loss.
Okay. So not keeping our scalp clean or not washing our hairs can actually lead to hair loss.
It attracts bacteria.
Right. And especially during monsoon, क्योंकि अभी सब जगह बहुत बारिश हो रही है कई इलाकों में देश के, तो ऐसे में monsoon में भी hair care बहुत मुश्किल हो जाता है और एक कॉमन प्रॉब्लम की बाल सूखते नहीं है, फिर झड़ने लगते हैं, तो monsoon में कैसे hair care करें डॉक्टर?
See, basically, when you generally in women, I have seen they tie turban after, they tie towel and they keep that towel on for many hours. That can cause a fungal infection. We call it as a pedra.
Oh.
Okay. So that should not be done. So in monsoon, when you don't get, good air to, dry your hair, then at least you can use blow dryer, which is cold one, or you sit under a very strong fan, okay, and dry your hair. But don't tie turban.
Okay. A basic hair care कोई ऐसे regime है कि हमको जो है wash करना चाहिए, oiling करना चाहिए, conditioning करना चाहिए, बहुत basic जो चीजें हम कर सकते हैं for a healthy scalp and hair.
Sleep well, eat well, not too much activities in the night, okay, and a balanced diet. In hair care, your good shampoo, that means which is like not making your hair frizzy and dry. Your conditioning is good for when you have the dry hair. Your oiling is good for your if you have the dry hair. Okay. That's all you have to do in day to day. And then you have to protect your hair from strong sunlight.
Okay.
If you're in summer, if you are not protecting your scalp, there could be, as we call as actinic hair loss. So it is actinic phylogenic film. So you need to protect your hair from that. Now,
and how to do that, doctor? How to protect our hair from? Okay, putting a scarf over it or a hat or
an umbrella. Use of an umbrella. In in rainy seasons, dry off your hair as soon as possible with method I described. Similarly, also in winter, okay, don't use too much of hot water on your hair.
Okay. Yes, this is again one very common, blunder that we commit. We use a lot of, hot, especially during winters. We like having hot showers, and of course, we put our head and hair under the shower as well. So that should be avoided.
Yes.
Okay. We'll pick few more questions, Dr. Namrata Yadav was asking, are dry scalp and dandruff the same thing?
No, it is not the same thing. It is not the same thing.
ओके पारुल रेखा सिंह पूछ रही हैं, मैम मम्मी बचपन में हेयर टाइप बांधती थी हेयर की ग्रोथ के लिए, तो क्या ये सही है?
It's not in all patients you see traction alopecia. The traction alopecia means we used to put the 2 ponytail, in the school, and we used to get hair loss from that at ages. That is called as a traction alopecia. That is not always in a scene, but when it is been seen, then you have to reduce that traction.
Okay. Or doctor, as we are moving towards the conclusion part of this session, anything, any take home message that you would like to share with our viewers?
With respect to hair loss and hair disorders, I would suggest that whatever you are taking medications online or from your friends' advice, just observe for a few weeks. If that is not giving you relief, then you don't neglect that condition. Because whatever hair you lose, to regrow that hair, it may take months. So by the time you will lose your volume, from this volume, it will come to this volume. And to get back the same volume, it may take many, many years. That will lose your confidence. So that is my advice.
A very, very important thing that you shared, Doctor, and it was a very informative session. Thank you so very much, Dr. Rachita Dhurat, for your valuable guidance and advice on how to keep our hair healthy, especially in the current scenario, where apart from other environmental and genetic factors, the increasing levels of pollution and stress are also taking a toll on our hair health. I'm sure your guidance will help our viewers, and viewers can also, relate to what you just said. So thank you so very much, Dr. Rachita Dhurat, once again for joining us. And viewers who want to get personal consultation from Dr. Rachita Dhurat, RD Clinic Mumbai is where you can go and visit. Big thank you to our viewers as well for watching the show. And for more information on how to get all your hair issues resolved, do like and subscribe to our YouTube channel, Hair All Issues Resolved. Thank you. A very great and good day to all of you. Bye-bye.
Thank you. Bye.